So I think music therapy is one of many entry points into treating the whole person, not as a medical record number or a room number or a prescription number, but the whole person with a life story, someone who's participated in the world in ways that are meaningful to him or her, and that gets interrupted by illness or injury or hospitalization, and that we can't go with that interruption. We need to stay with the person in front of us. So I think that's the beauty of integrative care. That's the beauty of multidisciplinary care. And we're in a really interesting time right now in history, because a long-established core of medical care has laid the trajectory of how people are treated, and that's slowly changing, but it's not fast enough. And I think an integrated philosophy held by practitioners across discipline is really in the service of best practice, seeing the whole person in front of us, not, as I said, a patient. I think it's, if we speak in historical and lay terms, that the physician was a solo entity traveling from town to town, and people would wait for the physician. And then, over time along came the nurse, who worked with the physician and took care of a lot of the things that the physician maybe did not have time to do. And then along came chaplaincy, and emerging with chaplaincy, which had always been in existence, and social work. And if we think about how the paradigm of healthcare has evolved from that very patriarchal place into what it is now, the space is created for change to happen. It's not easy to change. We have people coming in, subscribing to healthcare, and they come in with a belief system that's honed through practice, wellness, wholeness practice in their own lives. So people coming to medical care are coming with expectations of what care should be. And I think that the healthcare model needs to modify to meet those needs, that expectation. And it is, slowly, I emphasize.